One thing I have not talked about is the big C, the cortisol. The cortisol super dominates endorphins, dopamine, serotonin, and oxytocin. Cortisol simply is a hormone of survival. When I say hormone of survival, what I'm driving at is it keeps you alive. When you're in stress, cortisol goes up. When you're having an acute heart attack, cortisol goes up. Workplace, what happens to that secretary who's thinking, I'm not in a safe environment, I might lose my job? That's subconsciously doing something to her. It's saying that the cortisol is dripping because she's in a fight mode. She's in a protective mode. She doesn't trust, she's not cooperative. So she's doing the opposite. So if you're doing the opposite, what happens to cortisol for that individual? It drips, it won't flood. I mean, she's not having a heart attack, she's not having appendicitis, it's not acute, but it's going to constantly drip. When I'm saying it drips, what I'm driving at is there's a low-grade drip at work when there's stress. And she's defined the stress for herself, right or indifferent, she's defined it. So she's defined the stress, and the cortisol is just trickle, 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 trickle. So what is that doing to her? It's shutting down immune systems, it's shutting down unnecessary things, meaning if you were in a crisis, your gut's going to shut down. You're going to get less blood there. It's physiology. Your nails will not grow because they don't need them right now. All the energy is diverted somewhere else. So when we start saying that there's crisis or stress, low-level stress at work, this individual is getting a constant surge of cortisol. Cortisol shuts down immune systems. Cortisol does bad things if it's consistently provided. Short term is great. This is the hormone that causes what? It shuts down immune systems. What does it cause? Pneumonias, infections. These are the ones that cause unstable angina, MIs. It's not the lard in the bacon. It's at work. Some of these individuals actually feel threatened to come to work. They do. We don't know it. We are creating an environment, right or wrong, that they feel is stressful. And we may think, well, gosh, you should just come to me. I would have solved the problem. But that's not what was conveyed. You know, you're sitting here. She's not going to come to you. The two intermediate hierarchies in between may not have relayed the right messages. And for whatever reason, she doesn't feel comfortable. Let's say the same person finds out, we're in an office, same people say, hey, I heard there's a cutting jobs down. Traditionally, we know that every October they do budget, and by November they have to cut jobs. And the CEO has done it every year. Now, will the others, the beta, follow the alpha? Probably not, because it's a tradition. If we're talking about this and say, it looks like there's going to be a pay cut, everyone in this room or in this pool, one, no one's working, it's non-productive day or days. Two, you have cortisol dripping until you fix this problem, eroding your life, health overall. We need to go backtrack and say, how are we communicating our culture to our employees or our teammates? Had we sort of led this individual, the secretary, in the right path, you know what? She would have rolled the red carpet out. She's a good person. She would have rolled the red carpet. It's just that she feels like she's got to follow this book of rules. If not, this is what's going to happen. And someone's imparted that in her mind for whatever reason. But otherwise, had she had some comfort, I'm telling you, she would have just, there would be no complaints today. 99% of the time they do great. Is that 1% of the time that messes up the whole thing. I'm going to show you this video clip. Some of you might have seen it.
Good evening, folks. Welcome aboard Southwest Airlines Flight 372, service to Oklahoma City. Those of you that have flown us before know that we do things a little bit differently here on Southwest. Some of us tell jokes, some of us sing, some of us just stand there and look beautiful. I, unfortunately, can do none of those. So here's the one thing that I do know how to do. We're going to shake things up a little bit. I need a little audience participation. Otherwise, this is not going to go over well at all. So here's what I need, especially you guys in the front because you know what's coming. All right, I need a beat, all right? All I need you to do is stomp and clap, and I'm going to do the rest because I've had 5 flights today, and I just cannot do the regular boring announcement again. Otherwise, I'm going to put myself to sleep. So, you guys with me? All right. So, give me a stomp, clap, clap. Come on, stomp, clap, clap. Stay on beat there. There you go. Keep that going. This is Flight 372 on SWA. The flight attendants on board serving you today. Teresa in the middle, David in the back. My name is David, and I'm here to tell you that shortly after takeoff, first things first, there's soft drinks and coffee to quench your thirst. But if you want another kind of drink, then just holler. Alcoholic beverages will be $4. If a Monster Energy drink is your plan, that'll be $3, and you get the whole can. We won't take your cash, you gotta pay with plastic. If you have a coupon, then that's fantastic. We know you're ready to get to new places. Open up the bins, put away your suitcases. Carry on items, go under the seat in front of you, so none of you have things by your feet. If you have a seat on a row with the exit, we're gonna talk to you, so you might as well expect it. You gotta help evacuate in case we need you. If you don't want them, we're gonna reseat you. Before we leave, our advice is put away your electronic devices. Fasten your seatbelt, then put your trays up. Press the button to make the seat back raise up. Sit back, relax, have a good time. It's almost time to go, so I'm done with the rhyme. Thank you for the fact that I wasn't ignored. This is Southwest Airlines. Welcome aboard. Thank you very much for my beat. I appreciate that. You will not get that on United Airlines, I guarantee.
Does he feel safe at work? And he's done a great job. Every customer in that airplane probably loves him. Even though a couple of them is like, this is silly. He put his pen in his mouth and started going along the group. This is a safe environment. He knows he's working in a safe place. Marriott versus the Ritz. Why do you go to the Ritz? How many of you guys have gone to the Ritz or Four Seasons? Or why? Conference was held there. That's maybe one reason. But why would you go on your own? Marriott and the Ritz buy the mattresses from the same vendor. You're going there for a sleep, a bed. Marriott's a nice place. Okay, it's not shabby. I'm not saying Days Inn or Nights Inn. I'm saying Marriott. So why would you choose Ritz over Marriott? They buy the mattresses from the same place. It's a service. It truly is. It's how the Ritz delivers their service. They empower even the housekeeper. I don't know if you know this, but they empower the housekeeper that if you were not happy, if you came to me and I'm the housekeeper, you for whatever reason said something's wrong or whatever it is, you're not happy, the housekeeper has the empower to say, you know what, I'll take care of it, ma'am. If I can't, tonight's on the house. Would you allow that from your nurses on the floor? Probably not. So it's a powerful statement. Do you remember about 10 years ago, maybe 15, the Lean Six Sigma, the Toyota Way, came out and everybody was on it. How many of you guys, your facilities were engaging in some kind of Lean Six Sigma? Most of us waiting for the cocktails. We were looking for the magic pill. How did that go for you? You got this Lean Six Sigma, black belt Six Sigma and stuff. We had an engineer background that was hired full time. When we were going through cuts for nurses, they hired this guy floating around the hospital trying to understand the healthcare system. He knew nothing about the healthcare system. He had no right to be there when you're laying off nurses. He had no clue. What happened after 18 months? Zip, he was out. What did he deliver? Nothing. Why? It works for the automotive industry. But our hospitals are not factories. We have a human component that we forget. And we don't take that into account and nothing's going to work. I mean, we can set processes in place, but you got to have that human component in there, otherwise nothing's going to happen. This guy came out of some engineering school, I don't know where he came from, but he had a lot of credentials, knew the Six Sigma way, but he can't convert that factory concept here. To some degree you could, but you can't expect the same results. Toyota gets excellent results. They run a factory. They run a conveyor belt. You just got to clip, and keep going. I'm going to ask you, we always talk about why. I'm going to have you pretend for a second. I'm going to ask you to go between two buildings. Let's say the ground floor, just 10 feet off on the first floor, you put a 4x4 across two of these tall buildings, and I've asked you to walk across 4x4 very carefully. I'm going to give you $200 when you get to the end. Would you do it? $2,000 when you get to the end. I would do it. Come on. 10 feet. You don't have too far to go. Let's say it's 5 feet. 5 feet. I give you $2,000 to go across 5 feet. I'll do it. Some of us do it. For $2,000, what if it was ended up to $20,000? 5 feet off on a 4x4, you can walk. Now my point is, some of you would. If I said now we're going to go 100 feet, none of us would. What if I told you on the top of the building, you're on this building, and you have to go to the other side because your child is in that building and it's under fire. It's caught on fire. How many of you would then go? Things change. Why? I just said it. Why? The why matters now. Why are you going to go now? Because your child is there and the building's on fire. You're still going to run across. Because you have a purpose, you have a mission, you have a task to do it. If we can show our caregivers a reason, a why, most of the time they don't know the why. They truly don't. Sometimes we think they do, but they don't. Remember when antibiotics for pneumonia came out and you got to do it in 6 hours? And we kept telling the docs and nurses in the yard, got to give antibiotics, got to give it, and slap them and red chart this and flag it and call the pharmacy and page the pharmacy. We did all that crazy stuff. But not one time did someone come down and said to the nurses and the doctors, here's why we're doing it, guys. It says in the American College of Chest, it says in the American College of Pulmonologists, it says that this is the right thing to do. For the last 20 years, they've been saying it. Door to pneumonia, antibiotics, why they should do it. There's articles after articles after articles from reasonable sources that say you should do this. No one came down and told us that. They told us how to do it, but they never told us why to do it. Again, these are just articles that say why you should do it. Now, most of us in this room will agree that this chart basically says quarter after quarter after quarter, whatever the HCAP scores are identified in the ER is the same HCAP scores in the hospital. It runs parallel. Meaning, if you do a great job in the ER, it's going to be a great experience throughout the hospitalization, even if you mess up upstairs. Quarter after quarter after quarter after quarter. It's no different than when you go to the Marriott, give your keys for valet parking in Chicago. They charge you $80 to park, and he skids over and burns your rubber on your tires and scratches the side mirror. I don't care what they do now. For the rest of your 3-day stay at the Marriott, it will be the lousy experience for you. So whatever they do at the door is going to carry on to the rest of so we know this. Then administration used to come down and say, don't keep patients in the waiting room. He's going to come down twice a day, every shift change, because he knows we got to move this out. So then he brings data. Say, look, every time you make the patients wait, they're not happy. Then you get satisfaction by shift. Then you pull up satisfaction by volume. You get all this data out. Time spent in the ER, amount of delays related to the complaints. So patient satisfaction is directly related to the waiting. We know this. Now you're bringing data. What did the data do? Just made docs even more mad. They don't know how to read it. You think they read the data? What if you came down and said, studies have shown the malpractice rate for ED physicians is directly related to the number of complaints the physician receives. That is directly related to the length of the waiting in the ED. So what can I do to decrease the length of the wait in the ED to decrease your malpractice likelihood? You got my attention. You're talking my language now. What if I took the same chart and put a timeline and said, look, if the patient waits more than 60 minutes, you have a 4.16 more chance of patient suing you, doc, than if the patient waited less than 30 minutes. You got my attention now. This is the why. Then I said, I don't believe you. Then you pull up the data from Vanderbilt with 2,500 patients that exactly spell the same thing out. Again, this is why you could maybe change the shift. We want to talk why and out. But what do most people do? They talk about what, how, and why. Why do they do this in this sequence? Because what we do, everybody on this planet knows. How we do it, a few people know. What we do, very, very few people know. But human nature to follow what you know best, or what you know with clarity.